Now, you might be wondering how it's possible for babies to hold in their waste, and many people believe that babies simply have a stream of waste running out of them at all times, which every parent knows is not the case. Firstly, because they all urinate as soon as their diapers are taken off, and secondly, because every parent knows what their baby's pooping face looks like. We are aware of when our babies need the toilet, whether consciously or subconsciously. Now, the sad fact is that many pediatricians would probably advise you not to do this with your baby, as they often confuse this healthy, natural, worldwide practice with infant potty training, which is not even a thing, to be honest. It is not possible to potty train a baby, and no parent in their right mind would expect a baby to have any kind of autonomy over the pottying process. But the fact is that babies are programmed not to soil themselves, their beds, their clothes, or their caregivers, like many other mammals, including dogs and cats. Human babies have very clear signals that they show us if we know what to look for, and if we are able to get our brains out of the Western propaganda that all babies require diapering until the age of 2, 3, 4, even 5 years old, we can help them in a much more comfortable way. Recent large studies in China compared children whose parents used elimination communication from before the age of 1 year with children whose parents kept them in disposable diapers for more than 2 years, and the difference in bowel and bladder health is astounding. The disposable diaper group had 15 times more bowel and bladder dysfunction, including constipation, impactions, bedwetting, and urinary tract infections, than those who had been taken to the toilet before the age of 12 months. Several studies from different countries show similar results. Researchers in Brazil now believe that if every parent is taught this technique, that colic will disappear overnight, as the signs of colic are almost identical to the signs of needing the toilet. 2 more tips before we wrap up. Bonus tip number 1. If you find your baby latches fine at the breast or on the bottle, and about 1 minute into the feed they pull away and squirm, push you away, or seem like they're trying to get out of your arms, they are. Their gastrocolic reflex has been activated. Instead of panicking about your milk supply, take your baby to the toilet. When they're done, they will drink like an angel and usually fall off into a deep sleep. Bonus tip number 2. If you notice your baby sleeping restlessly, flopping from one side to the other, fidgeting, squirming, take them to the toilet. Remember that they need to wake up a little bit to be able to urinate. Babies don't actually generally urinate in their sleep. They wake up beforehand or just afterwards. Once their bladders are empty, they will usually go back to sleep immediately and sleep really well. Are you starting to see how moving away from the natural design of the human baby causes untold difficulties with feeding, sleeping, crying, cramps, and gas? We have doctors prescribing Nexium, simethicone, laxatives, all manner of powerful pharmaceuticals, and in the worst case scenario, parents are told to just shut the door and let the baby struggle and cry all by themselves. Obviously, this is not the answer and can be very harmful to a baby's health and emotional well-being well into their adult life. Never ignore a baby who's telling you that they need something, even if you believe it couldn't possibly be what you think it is.